Do you or someone you know have high blood pressure, also known as hypertension, or maybe even low blood pressure, known as hypotension? Today I want to talk to you about why it's such a great idea to take your blood pressure at home, whether it be manually or electronically. If you are a person to be on blood pressure medication, it is definitely important that you take your blood pressure at least once a day after you've taken your medication. So let's talk about how you would monitor. First, I want to begin with the why. It is so important to take your blood pressure because it's a leading cause for heart attack, stroke, even kidney diseases. So you want to make sure that your blood pressure is always monitored, especially when you're on medication or you've been diagnosed with either hypotension or hypertension. It's categorized to be hypertension once it hits over 140/90. Some websites say 130/90 as well, but majority are 140/90. According to the CDC, hypertension is one of the leading causes in death in the United States, and it has been responsible for nearly 1,300 deaths per year. And this was estimated back in 2017. So who knows how it would be any different now, and I would assume that it could be a little bit more escalated because there's less people that take care of themselves and we have more of a higher rate of obesity as well. Hypertension, like I said, puts everyone, when you have it, at risk for a heart attack, stroke, kidney disease. Also too, if you're hypotensive, it can start shutting down and not giving enough airflow to your organs, and then your organs will start failing. And sometimes people can have that going on and not even know. When a person is diagnosed with hypertension, they're more than likely placed on medications. And there's so many medications out there, I'm not even gonna get into all of them because it would just lose you. And that's to control their blood pressure. So usually if it's really elevated, we're giving them something that's trying to bring it down. And then that's one reason you want to be monitored at home, because if it drops you too low, then you can go into hypotension and your medication would need to be readjusted, or you might have done dietary and exercises that have made it to where you don't need the medication at all. 2, we want to make sure it's working. Just because we place you on a medication doesn't mean it's going to work. So if we have you monitor your blood pressure, or in the instance at my clinic, we have you come back in a week so we can check it. If it's still elevated, then maybe we need to raise your dosage, or maybe we need to add a medication or change the medication. But it's always nice to monitor. If a person's blood pressure is consistently too low, like I mentioned, it could decrease the blood flow to the organs. And then the same thing, if it's too high, you could clot, you could have a heart attack. So you want to be as close to 120/80 as possible. So this brings me to why you want to check your blood pressure at home. There are manual blood pressure cuffs, which are totally not easy for the person outside of a healthcare position to use necessarily. I mean, I'm not saying it's difficult for everybody, but it's not the easiest thing to do. So a lot of people use electronic cuffs. Now, the bad thing about electronic cuffs is it's technology. Technology has its flubs. So sometimes your machine can no longer be working correctly and give you wrong readings, isn't placed properly, or battery is gonna die. You can always take it into your local clinic and have them calibrate it next to what's been calibrated with theirs, or have them take it manually. In my clinic, if our first one is high on our electronic blood pressure machines, then we take the second one as nurses manually, just to double check to make sure there's no error with the computer machine. And then also too, it's our own ears. Hopefully they're not failing us, like the little ears in the computer system. So I'm gonna go over the steps on how to take your blood pressure. So we're just gonna come over here to my table. So you want to make sure that you're sitting at a table where your arm can be level, about heart length or above. You don't want it dropping down by your side. You want to make sure that no shunts, no IVs. A lot of people that have had radiation for breast problems, you don't want to use that arm. So I usually use my left arm because I'm right-handed when I do my own. So most come with a cuff. So you're gonna make sure that you're sitting up straight, your back against the chair, your feet are flat on the floor, mine are, trust me, and you're gonna put this about an inch or two right above your elbow crease. And then you're gonna make it as tight as you can. And you're gonna leave your palm up. You also wanna make sure that you haven't had any caffeine or any nicotine in the past 30 minutes because that could alter it. You wanna be relaxed for about 5 minutes, not, running around in circles to get your heart rate really going. No chewing gum, no talking while you're doing it. You wanna be the most relaxed position possible. So I would take my button here and push it. It takes a while, so I'm not gonna do it for you guys. And then it would give me a reading. The good thing about electronics as well is that you will get your pulse reading as well, which is something that also needs to be monitored on certain medications such as like amlodipine, also known as Norvasc. I'm gonna come back over here so I can stand for you guys. So that's how you would take your blood pressure. If it's consistently elevated, you would wanna make sure that you let your doctor know. Or if it's dropping too low on a certain medication, you would want to make sure that they know as well. The American Heart Association states that a normal heart rate is 60 to 100 and a normal blood pressure is 120/80. So you want to be close to those as possible. Now for me, I'm crazy. So my pulse always runs high in the 90s, but my blood pressure runs low, about 114/60. But because it's always been that way, that's considered my normal, even though it's on the lower side. I like to explain all this to all of my patients on how important it is because I've seen a lot of patients not take care of themselves and not make sure that their medication's working properly, and the side effects and the outcomes of those have not always been the greatest for some. So I really like to push that when someone has hypertension, that it's very important that they stay in contact with their doctor, that they follow the directions, and that they ask for help at any time that they need. That's about all I have for you guys. There's one reason they call it the silent killer, and that's because you could totally have side effects and not even know. So always make sure to be prepared, and always make sure that if you need to be checking it, that you do. And have a great day.